body, or this is the body. Yes, why I'm touched so this side also, because the body has two sides.
Anterior.
Why superior? Anterior and nasal surface.
Okay.
Yes. Next, has body and processes. This is, look at this line. This is also maxilla. How will be the name of this process of the maxilla?
Maxilla process.
Name of this process of maxilla.
I don't know.
Why you don't think? How called this process?
Zygomatic
Why it's
process.
called so?
Because
Because it connects with zygomatic.
This process connects with which bone?
Zygomatic.
Zygomatic. But how will be the name of this process? I don't know.
Zygomatic
Think.
process.
Why you have brain? Your brain, you know?
Study this.
If you have one. Next. Second process. Look at this part of the maxilla. Where is on the whole skull? This is between nasal and lacrimal bones. This. Now attached upward with frontal bone. And because called how? Hell. Frontal process. Next, this process of maxilla, where are located what? What's our located? Teeth. Alveolar process. Alveolar process, without teeth, not including teeth. And last, this process, how will be the name? Palatine process. Good. Again, maxilla has, be quiet, body, zygomatic process, frontal process, alveolar process, and palatine process. Maxilla has surfaces also. Anterior surface, name of this surface?
Nasal surface.
Nasal surface. Look, this is maxilla. This place is located here. How will be the name of this surface? Orbital surface. Which wall of the orbit is formed by?
The inferior surface.
And last, the back side, this part, called infratemporal surface. This region called temporal region.
So it's
Yes?
inferior.
Below, infratemporal surface. Next, body of maxilla is thick part of the bone, and inside is air sinus cavity, maxillary sinus, like frontal, ethmoid, sphenoid, edmastoid process of the temporal bone. Maxilla also has air sinus. Which part of the maxilla? Body of maxilla, not process, is body of maxilla. Next, the anterior surface, on the anterior surface of body is depression, fossa, called canine fossa. What are these depressions? Here is hole opening, which is under the orbit. How will be the name of this? How is it?
Infraorbital.
Infraorbital foramen. Next, finishes the body. Orbital surface, we talked, it forms the inferior wall of the orbit together with other bone. With which bone? Yes, with zygomatic. Look at this line. This is zygomatic bone, this is maxilla. Next, alveolar process. Give me the mandible. No, that mandible. The alveolar process has mandible also. Same structure they have. This is mandibular process. Yes, same you have in maxilla. Mandibular process forms alveolar arch, or two bones together forms arch. It's called, this portion called alveolar arch. Next, alveolar process has alveoles, these sockets, depressions, where are located the root of the teeth called alveolus or alveolar sockets, how you want. The alveolus are separated with together by the interalveolar septums. Understand? That's all. Next. Palatine processes of maxilla, two palatine processes, connect with together in the middle and together with horizontal plates of the palatine bones, these portions of palatine bone called horizontal plate. This portion which you show me, that is perpendicular plate. Or palatine processes of maxillas and horizontal plates of the palatine bone together forms hard palate. Yes? In the middle of the anterior side of hard palate is incisive canal. This incisive canal. Posteriorly, hard palate on the both sides have two foramens. Greater palatine foramen, lesser palatine foramen. Finishes the maxilla. Next bone, mandible. Main parts, body of mandible and ramuses of mandible. Body continues into the ramus and this border or how it is called mandibular angle. Ramus of mandible upward divides into two processes, coronoid process, condylar process. Condylar process has head, it is round shape, and condylar process of mandible connects with what? Mandibular fossa of the temporal bone. Between condylar and coronoid processes, mandibular notch. Next, mandible also has alveolar arch with alveolus and alveolar septums. On the inner side of the ramus presents mandibular foramen, paired, yes, right, left. By this foramen starts mandibular canal, which passes through the bone, inside the bone. That mandibular canal finishes by mental foramen, which presents on the external side of the mandible in chin region. This canal is for transmission of blood vessels and nerves, which inside the bone gives branches for blood supply and innervation of teeth of the lower jaw. Next, in the middle of the internal side, mandible has mandibular spine. This. Laterally from the spine, look at these red color places. Digastric fossas for attachment of digastric muscle. Next, this red line which passes along the inner side of the mandible called mylohyoid groove for attachment of mylohyoid muscle. Inner side of angle of the mandible, this red place. Pterygoid tuberosity for attachment of pterygoid muscle. And last, external side of the angle, this red color place, masseter tuberosity for attachment of masseter muscle. Finish the mandible. Now listen, except maxilla and mandible. For next lesson, you will study the orbit, nasal cavity, and pterygopalatine fossa. Generally, you know what is orbit, where it is located, and why we have orbit. Yeah. For what?
For the eye.
For eyes. Eyeball located in orbit.
So
Next.
For nose.
Orbit is bounded. How?
By four.
No. How called this border? Which orbital border? You have
the
this border.
superior.
Supraorbital border and infraorbital border. Orbit has how many walls?
4.
Superior, lateral, inferior, medial. Yes? Through the orbit passes canal
Optic canal.
and two what? Fissures.
Fissures.
Superior orbital and which will be inferior orbital fissure. How are formed the walls of the orbit? How is formed the superior wall of the orbit?
By the
Which part of the frontal bone?
superior.
Orbital part.
Orbital
Orbital
part
part
of the
of
frontal bone and deeply. What is? How continues from the
Sphenoid
center?
bone.
Which part?
Lesser.
Lesser wings of the
Yeah,
sphenoid
sphenoid
bone. Lateral wall. Anteriorly.
Zygomatic
Zygomatic
bone.
deeply.
Deeply sphenoid bone.
Which part of the sphenoid bone?
Greater wings.
Inferior wall is formed partly by which bone?
Zygomatic and
Zygomatic
maxilla.
maxilla.
Medial wall from here.
Lateral.
And deeply, think, deeply. Which part of the ethmoid? Labyrinth.
Labyrinth. Yeah.
That's all. Nasal cavity. Look inside the nose. Nasal cavity has floor or inferior wall. Yes?
Mm.
How it is formed? What do you think?
The
Con-
hyposphenoid that is going
attached to the maxilla.
Why I show you so?
because this part
What
of the
I show?
sphenoid
What
bone.
is here?
Mac-
What is this?
Palatal.
Palatine.
I'm showing you upper side of palate. Understand or not? Or the floor of the nasal cavity is formed by the palate.
Okay.
If you take totally the head region of the living person, that is totally palate, hard together with soft. But same on skull, you have only hard palate, which has opposite upper side, which is floor for nasal cavity. Understand? Next, it has roof or upper wall. How it is formed?
From this is
No,
the
nasal bone is not a roof, it is anterior part.
ethmoid
Which
bone.
part of that?
The
Horizontal.
curve.
That
No,
Cribriform.
cribriform.
Krista Gali, you have
Yeah,
in
yeah,
this position.
Cribriform.
Cribriform plate, but in front of cribriform plate you have other bone, small part. Which?
Yes, I forgot the name.
Frontal bone. This is anterior side, but it's from here it's continuous posteriorly. You don't remember the frontal? Give me the frontal bone. About which part I said? This part. It is located so. Here are nasal bones. Where are these spaces? In nasal cavity. Or the roof is formed by the nasal part of the frontal bone and cribriform plate of the ethmoid bone. Yes? In the middle it has what?
Boomer. No,
Crista Galli.
Septum.
Okay.
septum.
How is formed septum? You know?
The bone of the
The
vomer
vomer
And
cartilage.
vomer and cartilage.
The bony part is perpendicular
And
there's the cartilage and the
Forget about cartilage. You don't know
Okay.
cartilagian part. Or bone part is formed by vomer and perpendicular plate.
Plate of the ethmoid.
And last, nasal cavity has lateral walls. Two lateral walls. Yes? Generally, maybe you can tell me how are formed lateral walls of the nasal cavity. By which bones? Maybe you can tell.
Maxilla.
Maxilla. Next, upward
Zygomatic.
لا ماكسيلا فوق
sorry.
اسمه لا مش عارف
Nasal bone is anterior, external nose. It is no.
Maxilla and the
Ethmoid.
frontal bone.
Maxilla.
Excuse.
Which part of the maxilla? Body. But upward, which part of the maxilla? Frontal process.
This is the
Yes. Next, behind what you have?
frontal process
Think.
Ethmoid.
Before ethmoid,
lacrimal
lacrimal has this side, it has that side also.
Yes.
Like labyrinths, which forms medial wall of the orbit and at the same time lateral wall of the nasal cavity. Lacrimal bone also has two sides. Orbital side, nasal side. Understand? Behind of lacrimal bone, that ethmoid bone. Yes? Next is here. You know this. Which bone? Perpendicular plate of the palatine bone. And last, pterygoid
Pterygoid
process of the
process.
sphenoid bone. So many bones form the lateral wall. Understand? Or body of maxilla, frontal process of maxilla, lacrimal bone, ethmoid bone, palatine bone,
forms the
and sphenoid bone, pterygoid process. Next. On the lateral wall of the nasal cavity, we have what?
zygomatic bone
Again.
What's present on the lateral wall of the nasal cavity?
Three con.
Three
Three
conches.
conches.
How they called?
superior
Inferior, medial,
inferior
and
Superior conche is part of which bone? Middle conche is part of which bone?
maxilla.
no inferior maxilla
Inferior attached to maxilla, not the
And
bottom.
medial is part of
middle في النص okay wait
Okay, if I must you so, superior and middle conches are parts of which bone?
superior and medial superior is part of the lacrimal bone right wait
Just
1 minute okay here
Basic.
oh wait
I wait, but what you want, I don't understand.
the middle the middle
same.
Nasal.
It's not the same.
Same, yes, of
Same.
course. They
It's the same
Superior medial
the
same.
superior
Or
inferior
How many conches has the labyrinth of that ethmoid bone? Two. Which two?
The inferior and the medial.
Superior and
Inferior.
superior and medial.
Superior and medial. If you take separately ethmoid bone, how they call? Superior and which? Inferior.
Inferior.
If you take separated ethmoid bone, the conches of the ethmoid bone called superior and inferior. But if you take lateral wall of the nasal cavity, where are three conches, superior, middle, and inferior. Superior and middle conches, nasals, if you talked about the nasal cavity, are parts of the ethmoid bone. That's superior and inferior conches of the ethmoid. Inferior nasal conche is separated bone.
Attached to
You understand?
maxilla
Okay, again. Superior nasal conche is part of which bone?
ethmoid bone
Ethmoid. Which conche of the ethmoid bone?
superior concha.
Middle nasal conche is part of which bone?
Inferior concha of ethmoid bone.
Inferior nasal conche?
with the
Maxilla.
maxilla
Attached.
Part of the maxilla.
Attached to
Attached
maxilla.
to the
Close to
Not
the
the
Self-
bottom.
body of the man.
body of the man
Okay, next. The conches, that structures, divides the lateral wall, totally lateral wall, into three
parts.
meatuses. Meatus is called these spaces between conches.
superior
Superior nasal meatus, middle nasal meatus, inferior nasal meatus. These meatuses are for transmission of air from nasal cavity toward the air sinuses of the cranial bones. Superior nasal meatus transmits air to the sphenoid sinus and ethmoid sinus. Middle nasal meatus toward ethmoid, frontal, and maxillary sinus. Inferior nasal meatus is not for transmission of air. In inferior nasal meatus opens nasolacrimal canal. Which this canal? Why it's called so? What means lacrimal?
Part of the lacrimal passes through
no,
part
it's-
of the lacrimal
For
bone.
what will be that canal? For transmission of what? What you have lacrimal?
Bone.
Tears.
Tears.
Or
yes.
the
On the inferior eyelid, medial angle of inferior eyelid, visible little hole opening.
I know.
From where starts? Girls know very good, more good than boys. From where starts canal, which transmits tears from eyes
To know.
to the nose.
That's why we.
That's why I cried.
Finish the nasal cavity. And last part, pterygopalatine fossa. Look good where it is located. It's very small fossa. This small portion between maxilla and pterygoid process. Yes, this. This fossa is important fossa because blood vessels and nerves which comes to the pterygopalatine fossa from this region enter in different parts of the skull. For example, think, nerve is here. How it can enter the orbit from this region? Directly through the inferior orbital fissure.
Fissure.
Understand? Or pterygopalatine fossa is connected with orbit by the inferior orbital fissure. Next, pterygopalatine fossa is connected with inner side of the skull also. This region, other side of this region, is roof of the pterygopalatine fossa. Or nerve from here, how can enter the inner side of the skull?
Through the.
What?
the
Through what?
The fissure, right?
fissure برضو.
What I said, this region is roof. Which foramen you have here?
A lot of foramen. Ovally foramen.
I'm sure touch oval foramen. Or which foramen I
No.
touch?
Spinosaurus and the أخيرة كانت إيه؟
It's
Spinosaurus
ovale.
Rotundo.
Rotundum.
Round foramen.
Yes.
Rotundum.
Next, pterygopalatine fossa connects with oral cavity also. This region is oral cavity. Yes? Not interesting? I ask this. How it is connected with oral cavity? By the greater palatine foramen and lesser palatine foramens. Here we have pharynx. How the pterygopalatine fossa connects with pharynx?
The pharyngeal.
By the pterygoid canal, which passes through the pterygoid process. And last, pterygopalatine fossa is connected with nasal cavity through sphenopalatine foramen, which is not visible on this skull. It is not here, but it must be on the perpendicular plate of the palatine bone, or from here nerve directly through foramen of the perpendicular plate of the palatine bone enters nasal cavity. Understand? Oral cavity, pharynx, nasal cavity, orbit, inner side of skull. That's all.
This is the video.
Good evening.